my name is Karolina Kuberska and I'm a medical anthropologist working at the Healthcare Improvement Studies Institute at the University of Cambridge. Medical anthropology is a branch of anthropology that looks at the relationship of medicine and understandings of medicine and health. And it can be done in all kinds of contexts. I have chosen to use my skills to look at the way healthcare is delivered in the UK. So in my institute, we are looking at simple interventions and evaluating simple interventions to check whether just because something is easily available means that it works. So one of the projects that I'm working on at the moment looks at the use of visual identifiers such as stickers or wristbands for patients with dementia. And what we are trying to better understand is whether marking patients with dementia with such stickers or wristbands makes it easier for staff to provide appropriate care. Another project that I'm working on looks at evaluating remote care in antenatal care. So as you know, we are now in the pandemic, which means that a large portion of the care that women receive in pregnancy has been moved to the virtual world. So women receive phone calls or video consultations instead of face-to-face appointments. And we want to find out what is it about those remote appointments that makes them good and what makes them bad. And so who do they work for and who do they not work for? Before I worked at the University of Cambridge, I worked at the University of Birmingham on a project about pregnancy loss, which looked at how people are told about what can be done with the body of their baby. Perhaps it's worth saying how I got here, how a migrant got to work at the University of Cambridge. So I was born in Poland and I went to primary school there and high school there and the first university and the second university. The first thing I ever studied was English. And then when I was studying it, I discovered that there is something like anthropology, and I thought, like, this is just amazing, bananas, I need to study that. So I changed my majors and I studied anthropology. And very broadly speaking, anthropology tries to explain why is it that even though people are so similar to each other biologically, they organize their worlds in such different ways. They have very different values, they have different ways of going around things, they prefer different foods, and so on. I think anthropology is quite fascinating, but I appreciate that not everybody might think that. So I ended up working with migrants in Bolivia. So Bolivia is a country in Latin America that is landlocked, and a large portion of it is in the mountains, in the Andes, and an even larger portion of it is in the lowlands. And starting from the 50s, people living in the Andes started moving to the lowlands because they were being given land. And I worked in the largest city in Bolivia called Santa Cruz de la Sierra with migrants from highlands, and I did research there twice. Once I looked at the reasons for migration, for the contemporary migration, and the second time I worked there, I looked at maternal health. And that research was the basis of my doctoral research that I did at the University of St Andrews in Scotland. And I finished that, and then I got a job at Birmingham in the project about pregnancy loss. And then I got a job at the University of Cambridge. I think medical anthropology has a lot to offer when it comes to understandings of health, illness, and well-being. I really enjoy my work. I like doing all kinds of things, writing and interviewing people and observing them and doing a little bit of admin, but also traveling. And I think medical anthropology has a lot to offer to improving healthcare in the UK and all over the world.